All right, it's recording. Back in March, how many of you guys were like me where Crystal says she was in the hospital and she lost 2 family members from it? Crystal, I would love for you to share in a bit here with your experience. And thank you for sharing that. Back in March, how many of you guys were like me where you thought that COVID is just one major flu, like one serious flu, right? It's like the flu, but it's just like more serious than the flu, or maybe less serious, who knows, right? And most of us thought it was just a bad flu where it just affected your lungs, right? It causes a fever, a cough, shortness of breath, sore throat, just basically flu-like symptoms is what we expected from COVID. How many of you guys have now heard that it's more than just flu-like symptoms? Just, that's a lot of yeses here, right? More than just flu-like symptoms. I want to have some of you guys come on, and for those of you who have had or have been hospitalized with this condition, would love for you to just come on and share a little bit of your story with that. Crystal, I'm gonna have you come on. Hold on, let me get you on here. Let's see, you can unmute, Crystal.
Okay, hi.
Hey, good to see you.
Nice to see you as well.
Yeah, thank you for coming on. So, yeah, tell us what happened. Tell us what happened to you.
So from the very beginning of COVID, I've been quarantined. My family, I have 4 children and a partner, and we've been quarantined really since March 11th. So we took it very seriously, wore masks. My grandpa had leukemia, so we were just really trying to protect ourselves and just not really sure what it was all about, but not wanting to take any chances. My partner, he returned back to work in May. He works in automotive manufacturing. So although they were wearing masks, they started to have COVID outbreaks at his work. So he's in quality, so he interacts with everybody on his shift. And he started noticing certain things that were happening, like cleaning procedures he didn't think were proper, and started, letting HR know. Unfortunately, they didn't take it seriously, and there was a huge outbreak at his work from June to July, and he brought it home. So although we weren't leaving the house, missing things with family and friends and taking it seriously, we still got it. And so it's hard for me to breathe still, so I'm going to brace myself. But anyways, I ended up in the ICU. I was in the hospital for 7 days. We knew from the beginning that if I got it, because I have a history of pneumonia, or if my daughter got it, who has asthma, it wouldn't be good. So my partner didn't have the same like lung symptoms I did. He had just kind of like a really bad headache and didn't realize that he had it. And then I started to get, fatigued. I got a really, really bad migraine, lots of eye pain, where I couldn't even look side to side without feeling like something was like a Band-Aid pulling on my eyeballs. It was something I never experienced before. Pretty soon I started to get fevers, and then I started to have trouble breathing. So I went in to get a test. Now, this was around the time where people weren't testing as much. The tests were actually being pulled back. And it took me like almost 2 days to get in to be able to get tested. And I eventually was able to get a test and had to go through like 3 different screenings for them to even give me one. And this is because I had severe symptoms. So a lot of people during that time in July didn't have the severe symptoms I did and didn't have the same access to testing, which was, I think, why our numbers were so high in July. People didn't know they had it. But anyways, I got tested on a Monday and my oxygen was low, again, trouble breathing. And the doctor basically said, like, check your oxygen. If it goes below a certain level or you continue to have trouble breathing, just go to the ER. So at that point, it was like mid to the end of July, and my insurance was not kicking in until August 1st. So I was thinking in my head, I can just hold off until August. If it gets bad, then I'll go to the hospital. That only lasted 4 days because my oxygen was in the 80s and I couldn't breathe. So I went to the hospital and was tested in the hospital. My original COVID test hadn't come back yet. And they said, you have COVID and you also have like a light pneumonia. So they admitted me into the ER or in the ER, they admitted me into ICU and I was there and treated for COVID and pneumonia.
Wow.
Wow. How long were you in the ICU?
I was in the ICU about 2 days, and then I was transferred to where I think it's telemetry. I don't know if I'm saying it right, where they monitor your heart.
Yeah.
So I was my heart rate was like going into the 40s, and my BP was like extremely low. I'm 35 years old. Like I mentioned, I have 4 children, so I'm always like running around and active. And at this point, I was using a commode next to my bed just to use the restroom and had to get nurse assistance just to even step out of my bed to go to the commode. So I had literally no strength. And I had fevers for about a week and a half.
Just every day?
Every day. I would have like an hour's out, like maybe like 5 or 6 hours span where I wouldn't have a fever and I would think, oh my gosh, it's going away. And this is like with ice packs all over my body. And then, it would spike at nighttime. So yeah, it took about a week and a half for them to go away from when they started.
So it's interesting, guys, because this virus we think of as the bad flu, but a very common symptom of this virus is a headache, right? That's what I heard. How many of you guys have now? How many weeks now or months has it been since you were discharged?
Let's see. Well, I had COVID. I got COVID 4.5 months ago. So it's been a little over 4 months that I was discharged. And I'm having symptoms still. I'm having after effects. It's like it's lingering.
What do you have? What kind of symptoms do you have still?
Well, I lost like 50% of my hair. I've been losing my hair in chunks since September. So that's more cosmetic, that's not that big of a deal. But I can't breathe very well. I live in a 2-story house and before I could run up and down my stairs, like no problem. And now just walking up my stairs, it's like I'm almost asthmatic. So that's one of the hardest ones. I've had extreme weight loss and gain within a short period of time. Let's see, I have extreme brain pain. So it's different than a headache. It's like the diameter of a straw very deep inside of my head. It's usually on just this side and I can kind of put pressure on it to make it not hurt as much. But it's different than a migraine. And I still get the migraines from time to time if maybe I didn't sleep very well the night before, which is a possibility because I have trouble sleeping now after COVID. I had very extreme brain fog after COVID, and now it's like I see a lot of neurological things in relation to memory. So I can't remember like coworkers' names sometimes or the name of an item that I use every day, like things that I wouldn't normally forget. And I didn't have that before COVID.
Brain fog, huh? Have anyone here heard of post-COVID brain fog before? Type in yes if you have brain fog. Yeah, because in March, I just thought it was like the big flu. I never thought about headaches and brain fog and all these brain symptoms and memory symptoms, right? So it's still kind of lingering now.
Yeah. And so I actually joined a COVID support group to kind of see like, is this just me or do other people other long haulers is what they call us, have the same symptoms. And I was shocked. Like there's people that had COVID like 8 months ago, and they're still experiencing some of the things that I'm experiencing. So it's not like a fluke thing that, I just happen to have after effects. It's like hundreds of people from just my support group that I'm in that I'm seeing.
I see. Okay. Yeah. So a lot of neurological symptoms that continue with that. Yeah. It's a new. It's definitely new to us as physicians because it's such a new virus that we're just kind of learning it ourselves. But definitely something that is more common than we expect. Oh, did you have any issues with your taste or smell?
No, but my partner did. He still doesn't have taste or smell, but what I've been noticing is my friends that had more of a mild COVID lost taste and smell, and then the people that had more extreme, like me, maybe were treated in the hospital, didn't have that issue.
Interesting. Okay. Yeah, because I mean, if you have the flu, it shouldn't cause the loss of taste and smell long term. So your partner still hasn't got his taste or smell back?
Yeah, he can have sensations when he eats. Like if he eats, he will eat spicy food so he can get the sensation of the spice, but can't actually taste anything.
Really?
And yeah, and smell is the same way. So when I cook for him, it's more like for texture, different things, spicing things up or adding citrus, because he can get a sensation. But yeah, that's been very hard because those were senses that were really important to him. So I don't know what that's like, but a lot of people are dealing with that.
I see. Interesting. Hey, thank you so much for sharing.
Sure.
Yeah, certainly appreciate that. Who else here had COVID who wants to share? Type in the chat box if you've had it and you want to, so we can. Michelle, unmute yourself. Where are you?
Hi, sit down. My daughter and I both had it. So Katie, this is Katie. She worked at Trader Joe's and they still have amazing safety protocols in place. And the break room was one person at a time without a mask, but it only took one person, asymptomatic person. And so she caught it. And then I still.
Well, originally my boss was telling people to only get tested if you have symptoms, which.
This is back in August.
Obviously asymptomatic people are still spreaders. But
so she brought it home and we isolated her and we brought her food. She had all of the symptoms pretty much, started with a sore throat, had a headache, did a video call to get tested, got tested the very next day, that was a Saturday, got the results Monday.
Yeah.
It was a quick turnaround time, but they said at the time 4 to 7 days, so that was pretty good. And she recovered in about 10 days, 7 days.
It took me about 10 days to recover.
She lost smell and taste, but regained those. Tried going back to work once she was no longer symptomatic and no longer, after 10 days, after she got cleared, she was no longer contagious or anything, and lasted about 3 hours and came home because she was exhausted. I started feeling off on the day she got her test results, and I thought it was all in my head because it was pretty mild. And I continued exercising, I continued bicycling. I just was like, my psychosomatic is really strong because by Friday, I still feel crappy. My husband and I got tested on Thursday because she lived under the same roof. And I started feeling really sick on Friday, Saturday, big fever, Sunday. It wasn't until Tuesday that I got really scared because I had excruciating back pain, excruciating headache. I really couldn't breathe. My fever wouldn't go down anymore. I was so fatigued, like Crystal was saying, I couldn't It was really scary. And because most of the doctors had said, you know, takes about 10 days, by about 10 days, you start getting better. And that was when I started getting worse. So that kind of scared me. And it was about another week before I was able to be fever free for 3 days. I was able to go downstairs. I had to do a stress test about 3 weeks later, and they require you to do another COVID test. And so I did a rapid test and tested negative. So I kind of confirmed that I was no longer contagious, but I still have, I can hear it in my voice. I have major chest pressure. I have major brain fog. I had 3 days in a row this week where I felt like my energy was coming back. I could concentrate a little bit. And then today, this afternoon, chest pressure's back. I have really bad ankle and knee, sometimes elbow pain, like joint pain. I don't know. Anything else?
Okay. Yeah, so brain fog, chest pressure, fatigue, just persistent fatigue.
Oh, and racing heart, but not all. It'll my heartbeat will go way up and then way down, and then way up and way down, and my blood pressure is super low still.
Okay, although you're cleared from COVID theoretically.
Cleared. I was cleared. I don't remember when I've been cleared for a few months.
Yeah, it was August 1st that I got tested.
Okay, so
She has no post symptoms at all.
she's young.
Told by my doctor when I first called, they said you'll most likely like have a fever and that's it. But I had every symptom. I had back pain. I had trouble breathing. I lost my taste and smell. I couldn't get out of bed for some days. Like I couldn't.
And we've been isolating since March. I mean, we have.
Well, I mean, I had to go to work, but yeah.
Do you guys, we've noticed that memory loss has been a big issue as well. Concentration, memory loss, focus, kind of like your brain's in a fog.
Yeah, I cannot multitask anymore. They were cooking while I was trying to listen, and then they're getting questions. I was like, I can't listen to what's happening and what you guys need. I can't do that anymore. And I always used to be able to multitask. That's very, very frustrating. Yes, go eat.
Okay.
So.
Yeah, and we are all praying that these symptoms will go away. We don't know enough about COVID to know where this is going to head, to know if this is going to be chronic or not chronic, or so there's not enough information yet. But all these post-COVID symptoms, especially all the brain symptoms, is something that we're noticing. Consistently, we're seeing brain fog, we're seeing headaches, we're seeing dizziness, and of course the loss of, did you have any loss of smell or taste?
I did, and I didn't realize that I had. I was trying to do my essential oils, the breathing one, to I was like, I must be out because I don't smell anything at all. And then I smelled it again, and that was gone, like completely gone. My taste was suppressed. I could taste spicy, but now listening to Crystal, probably was a sensation more than a taste. And then that slowly come back, but it's still, I think it's still suppressed, which is a bummer because I really like food a lot.
So are you saying this is kind of like a weight loss program here?
I wish I could say it was a weight loss program, but that has not been my experience at all. Hence the fasting that I'm doing now.
Nice. Life in the fast. Nice.
Yeah.
Awesome. Yeah. Thank you so much for sharing.
Dr. Turin, can I ask a question?
Yes.
Yeah. What about Donald Trump? After 2 days, he was awake. He was campaigning. He didn't have any symptom as they are suggesting. What happened?
Everyone responds differently. And the only other thing is, if you're the president, you probably got the best care in the world. and you probably got medication that wasn't available to everyone else. Right? So that's, yes. Anyone else want to share? So we're seeing a trend here: loss of taste and smell, brain fog that is there, trouble concentrating, shortness of breath. Anyone else? Are you?
Dr. Trent,
Yes.
Dr. Trent, can I just ask a question?
Yeah.
Michelle mentioned back pain, but nobody else has. Is that a typical symptom or an unusual symptom?
Joint pain is a very
No, back pain.
yeah.
My daughter also had the back pain, and my son's college roommate said that he had no symptoms, but kind of lost his sense of taste and smell. So I was like, well, you probably had it. And he said, the weird thing is I had a really bad backache. And I thought, we're the only 3 people I've heard of that have complained about that. But it was obnoxiously scary bad, not muscle bad, but internal scary.
I see.
Thank you.
Thank you. Vicky, are you there? No, Vicky has some issues with it. Maybe not. All right. Yeah, so it's like, what's going on, guys? I thought this is just a problem with the lungs. When we talk about coronavirus, right? We think about like the pneumonia, which occurs. One of the most common reasons I admit patients to the hospital with coronavirus is actually pneumonia. We call it COVID pneumonia. We will see the changes on chest x-ray, and it's fairly common. Susie says, what do you think about building a healthy immune system? Very important, very important. If you guys were here from the last talk we did on COVID, was that like a week ago, guys, or 2 weeks ago? I don't remember anymore. Maybe 2 weeks ago.
2 weeks, yeah.
2 weeks, okay. See, my memory's bad, and I'm losing hair. I wonder if I got a little bit of, virus or something. But we talked last time about inflammation and how coronavirus stimulates inflammation in our system. And that inflammation causes long-term damage to our system, where the long-term damage causes damage to the blood vessels, which leads to blood clots that form. We call that thrombi or microthrombi, blood clots. How many of you guys are aware that coronavirus causes heart attacks and strokes? We are seeing a lot of that. I have admitted patients with heart attacks and strokes as a result of coronavirus. And that is simply from the blood clot that forms from the inflammation, okay, that damages the blood vessels. And so if you get a blood clot that forms, in your lungs, right? That's a PE, pulmonary embolus. If you get a blood clot that's in your leg, we call that a DVT, deep vein thrombosis. If you get that blood clot in your heart, we call that a heart attack. And if the blood clot is on your brain, we call that a stroke, right? So the diagnosis depends really on the location of where this blood clot is what we call it, whether it's a heart attack, a stroke, and things of that sort. Deidre, yes, cytokines. Cytokines is the inflammation enzymes that are secreted by your immune system that causes inflammation with that. Crystal says, yes, I was on blood thinners in the hospital. Your white blood cell count went down to 1.2, yes. And it helped to bring the anti-inflammatory markers down. That's right, blood thinners is something that's given now pretty often, guys, in the hospital for severe COVID patients with severe symptoms in the ICU when they're super sick. And we give blood thinners to prevent these blood clots. We don't do that for the flu, right? We don't give blood thinners for the flu, but with COVID, yes, to prevent that microthrombi that is created. Vicky says, mine was similar. After 2 months, I still have headaches, brain fog. Whoa. Vicky, unmute yourself. Why don't you come down and share with us a little bit on what's going on?
Can you hear me? Can you hear me now?
Let me see if I can pull up Vicky. Where are you, Vicky?
Here.
Did you turn on your video?
Here. No video. Okay, I'm doing this. Wait.
Do you know how to turn on your video? All right. Oh, Vicky, you still have brain fog.
Can you hear me? Can you hear me?
I don't really hear you that well. Can you guys hear okay or no?
I'm trying really hard. My computer's not working, my laptop, and my phone's not helping.
Sorry, Vicky.
Can you hear me now? No?
We can't really hear you.
Okay, sorry. Next time.
No worries. You can type down. I wanted to hear what your experience was, but
I typed it.
okay. So yeah, Vicky says hers is similar after 2 months. She still has headache, brain fog, very weak and tired with no energy. Very similar. Vicky, did you have loss of taste and smell?
I'm typing. Yes.
Yeah? Okay, she has loss of taste and smell also. Are you guys seeing a theme of these common symptoms that affect the brain with that? Common symptoms that affect the brain in a condition that we thought was just a bad flu, right? Now, how many of you guys know why that is? Let me ask you a question. How does this virus that goes to your lung, how does it get to your brain, right? Why do we have these brain symptoms for a virus that goes to your lung? Isn't that kind of odd? Right? Is it through the blood? Lynn says inflammation. Inflammation plays a role. Kind of like inflammation plays a role in Alzheimer's, right? Inflammation causes the plaque that builds up in Alzheimer's patients. Sue says inflammation. Blood goes everywhere. Okay. All right. Maybe through the nerve. I'm going to show you guys a picture. I'm going to show you guys a picture. I'm going to share my screen. And let's see here. Do you guys see my screen? Type in yes. Type in yes if you see my screen.
Oh. Lizzie.
All right. Yes, but not clearly, huh? Okay. Take a look at this picture, guys. Take a look at this picture. This is on an electron microscope. An electron microscope that sees things all the way down to the very details of things. Do you know what these red dots are? Anyone know what these red dots are? Want to take a guess?
COVID.
What are these red dots? RBC, interesting. These red dots, Mike says, Patricia says blood, Carolyn says COVID, Vicky says RBC, red blood cell. Iron, you guys are good. Let's pull up another picture for you guys here. I'm going to do a search. Does anyone know the name of the nerve that affects taste. Anyone know the name of the nerve that affects taste? There's a nerve. Anyone know? If you do, type it up. All right. Hey, you guys are, got a few scientists here. That's right, the olfactory nerve. Nice. Let's type that up. Olfactory nerve. Nerve. Olfactory nerve is the nerve that allows you to taste, right? Now, let me ask you a question here. This is our brain, right? This is the organ that COVID is affecting, where you get headaches, memory loss, brain fog, fatigue, right? And we know that the lack of smell and taste is a very common symptom of COVID. Okay, very common symptom of COVID. Just about everyone that I know has that. Okay, are you guys following me so far? And and the loss of smell and taste affects what we call the olfactory nerve, right? The olfactory nerve is the nerve that deals with smell. Now, let me pull up this picture here. Take a look at this picture, guys. Do you see these little branches here? This is the olfactory nerve and its branches. Do you guys see that? If you do, type in yes. If you do, type in yes. Everyone sees the olfactory nerve? Cool. And the little branches that come out of it. Now, let me ask you a question. Where is this olfactory nerve located in the body here, in the face? Where is it hanging out at? That's right. This is the nasal cavity. This is the nose cavity, right? This is the nose cavity. Now, let me ask you this. How does COVID enter your body? How does COVID enter your body? That's right. Any opening, right? The mouth, the nose, and the eyes. So do you see from here? I'm going to trace it for you here. COVID ends through your nostril here, right? COVID comes through your nostril. You're breathing it in because you're not wearing a mask or whatever, right? You're breathing it in. It enters your nostril. So how does this get to your brain? It goes right up here, right through this nerve, because this nerve is attached to your brain. It's part of your brain. And as it goes up the nerve from your nose, it causes inflammation, right? It causes damage to the olfactory nerve. It causes damage to the olfactory nerve as it enters your brain. Do you now understand why the lack of taste and smell is part of COVID? Does it make sense to you now? Does this make sense? Why doesn't it enter your ear? Because your eardrums block it, right? This, guys, is the anatomy of why patients with COVID cannot smell or taste. Because it goes through your nose and it attacks the nerves that are sitting right here. And this is your olfactory nerve. And it messes up your smell as it goes up your brain with that. As a matter of fact, this picture here is the olfactory nerve. This picture here is the olfactory nerve under the electron microscope. And these little round red things, that's COVID. That's the coronavirus. That's the coronavirus. That's inside the olfactory nerve. Isn't that crazy? We now have evidence of how it enters your brain. Do you understand now why COVID is causing all these brain symptoms? Right? Why doesn't everyone have loss of taste and smell? Because for some folks, it goes down straight through, down into their lungs, and it doesn't hang out as much here. Other patients, they have an immune system that maybe blocks it in this area, right? But this is now the reason that I wanted to explain to you guys why we have all these brain symptoms. That's how COVID enters your brain. It enters through the olfactory nerve in your nose. And that's why it causes the loss of smell and taste. Does it make sense now? Am I connecting the dots for you guys? Right? I want to make sure that I connect the dots for you guys with that. Now you know. Now you know why patients with coronavirus, they have brain fog, right? Headaches, memory problems, because that's how COVID gets to the brain, through the nerve. And then when it gets up there, it causes inflammation up here. And the inflammations that's caused up here causes the brain fog that results from there, right? The brain fog with that. Susie says, would it be good to cleanse with saline? It's okay, but by the time you figure out you got it, it's already ran up your nose with that. How do you reduce inflammation? Are you guys ready? Are you guys ready? I'm going to give you a few things, right, to take notes on reducing inflammation. There are several ways to reduce inflammation. Number one, there's two categories of inflammation reduction. The first category is to avoid the things that causes inflammation. And the second category is to do the things that help with anti-inflammation, right? To avoid inflammation, there are a few types of foods that you should have. Lynn says some people's doctors recommend mouthwash. Okay. That may help with your mouth. I'm not sure if that helps with your nostril with that. To avoid inflammation, cut out on sugar. Cut out on sugar and cut out on carbs, on carbohydrates that break down to sugar. Yes, that includes white bread. Minimize your white rice, your pasta, your spaghetti, your pizza, because all that stuff breaks down to sugar. Sugar is pro-inflammatory. Okay, number one. Number two, minimize red meat. It's basically the American diet I'm saying to avoid. Right? Minimize red meat. Red meat is pro-inflammatory. If you're a carnivore like I am, try to do fish, chicken, things of that sort. Even with chicken today, you got to buy like the ones that have no antibiotics and all the other stuff that they do our chicken now these days. With that, okay? So minimize red meat. Number three, minimize dairy. Minimize dairy products. Why is that? Because dairy comes from milk. And the quality of your milk depends on the health of your cows. How healthy are our cows these days, guys? Right? We unfortunately, I don't know about Canada, but in the US, we often pump up our cows with antibiotics. We pump them up with growth hormones, right? And uh, and all that junk that's pumped up to our cows, it comes into the milk, and then we make dairy products out of that, right? Minimize that. Patricia says, is there anything left to eat? Okay, or is there anything left to ear? Number 3, minimize fried foods, fast foods. Those are high in trans fat. Those are high in preservatives and all the junk stuff that that is pro-inflammatory with that. Kathy Newport's looking at me with a frown. I'm destroying your diet, ain't I, Kathy? Okay.
Dr. Trin,
Yes.
you said minimize fast food, and what was the other part of that?
Fried foods.
Fried, thank you.
Yeah. Now, try to avoid gluten. Is it gluten? Am I saying it right? Is it gluten or glutton or whatever? Gluten? Sorry, English is not my first language. I went through ESL. Oh, good. Thanks, Paula. Yes, gluten is not friendly for our gut, and it causes gluten sensitivity, celiac sprue, things of that sort, and it creates inflammation of our gut. Have we done a gut health lecture for you guys yet on here? No? Yes? I don't remember anymore. My memory's kind of bad. I'll do a gut health lecture for you guys sometime. Gluten like gluteus maximus. Okay, thanks, Clemmy. Got it. Now, what should you eat? Okay, what should you eat? I am a big recommender of a plant-based. Well, here's where knowledge and action doesn't connect. I recommend plant-based food for you, but yeah, I eat meat. Right? Knowledge and action does not connect, which is why in 2 Mondays, we're going to try to fix this. Plant-based diet, guys. Plant-based for the win, right? More veggies, the better with that. Pistachios. Number two, so first is green leafy vegetables. Second is really any vegetables, okay? Number 3 is nuts. What's the name of the documentary, Crystal? So nuts is number 3. That could be walnuts, pistachios, pecans. I don't know the name of all the nuts, but whatever, almonds, whatever they sell at Costco, you know, that mixed nut thing that doesn't have salt in it, that's what I try to eat. Okay. Is peanut a nut? Is peanut a nut? Yes or no? No? Oh, it's a legume. Okay. It's a no lagoon. Okay. So peanut's not a nut. Next on the list is beans. Beans is a good source of fiber. Beans is also pretty good for the brain. I'll have to look up the specific compound in beans that make it healthy with that. Next one is fish. Omega-3 fatty acid. right? Strong anti-inflammatory, omega-3 fatty acid, fish. Next one is if you don't eat red meat, you can do poultry, such as chicken or turkey, or even chicken feet, right? Or even chicken feet. Yeah, I know Kathy Newport likes chicken feet. I think she eats it like she's doing a pedicure, like this. So anyway, so chicken. Next one is olive oil. Olive oil is super good. Susie says Juice Plus. Yes, I want to chat about Juice Plus. Yes, olive oil, super important, and a glass of wine, specifically red, for those who drink. If you don't drink, do not start. Okay, do not conclude from this lecture saying that Dr. Trin recommends for COVID treatment, I start to drink alcohol. That's not my recommendation. But if you already drink a glass of red, because of an ingredient in there called, does anyone know the name of the ingredient in red wine that makes it healthy? You guys are good. Yes, resveratrol. That's right. Resveratrol is the name of the ingredient. It comes from the skin of red grapes. Comes from the skin of red grapes. With that, Vicky says, "What about pho?" Okay. Yes, pho is very therapeutic. It cures everything. Now, yes, it's an antioxidant. It is. Now, what if you guys are like me, where you know that eating fruits and vegetables is super healthy, but you have a difficult time eating it all day? Yeah, some of you guys do, right? So how do you cheat and get around that? How do you cheat and get around that? Does anyone know? How do you cheat and get around that? Michelle says juicer. Ah, okay. But do you juice like every day? Right? So here's one way to cheat and get around that. Have you heard of Juice Plus? Who here does Juice Plus? Susie? Hold on, I'm gonna bring you on. Have you heard of Juice Plus? Hold on, I'm gonna bring you on here. Are you on?
I'm on.
Oh, hey, tell us about, so Juice Plus. I've chatted with you in the past about that, right? Because
You did.
I used to take Juice Plus, guys. What it is how many vegetables and fruit do they put together into like one thing?
Well, into the fruits and the vegetables come side by side, and in total, it's 20 raw fresh fruits and vegetables.
Into like a pill?
Mm-hmm. Into 2 capsules. You would take 2 of the fruits and 2 of the vegetables. And they also have a vineyard blend, which is the berries. And the 3 of them come out to 30 raw fresh fruits, vegetables, and berries in capsule or gummy form. And I know you took the gummies.
Yeah, I used to take the gummies and I fed it to my kids and my wife because we were like, we know it's healthy, but we're kind of lazy. So we just pop the Juice Plus gummy. I don't know, but it's kind of like those who want to get to ketosis, right? They take the ketone supplements to get them straight to ketosis rather than try to do what I do, which is fasting to get to ketosis. But so Juice Plus has so what you can get it in capsules or what? Or I know I took.
Yeah, they come in capsules and they come in gummy form for kids and for adults that can't swallow the capsules. And it's not meant to replace fruits and vegetables. It's just meant to, fill the gap of what you're not getting on a daily basis.
I see. Yeah, I've seen some science behind Juice Plus, and what they did was it's kind of like a supplement, but they put a whole bunch of veggies and fruits, and they kind of grind it all down into that much, right?
Yeah, how I can explain that better is they have growers, and it's grown, fruits and vegetables that have been grown and vine ripened and taken to the plant, and they juice down, and they take out the sugar and the sodium for people that might be diabetic or have high blood pressure. And they do a slow proprietary drying process and put it into capsule and gummy form. And it's probably been one of the better things I've done in my life, 19 years of it. So good stuff. It's a good way to get, to fill the gap of what you're not getting on a daily basis. And it does carry a nutrition label.
Wow.
And it is GMO free and gluten free. And yeah, it has 38 published studies at universities and hospitals around the world, and on inflammation being one of the #1 studies that they've done, and it takes inflammation down in the body. So, inflammation, you name it, it's the root of all evil.
Yes. Hey, thanks so much. Thanks for sharing that. Can you put in the chat box how somebody who want more information about it can get it, or how they can reach you if they have questions or whatever?
Sure, I'd love to. Thank you.
Thanks so much. Very cool. I'm not sure where to get Juice Plus, guys. I used to take it all the time because it kind of replaced my poor diet. But Susie's going to put in the chat box here some information if you're interested on that. So anti-inflammation is the key to minimize the inflammation from coronavirus that's affected brain health. With this, when the virus goes up there, in the same way that it inflames the lungs to cause pneumonia, it can cause inflammation up here as well, which can lead to brain fog and headaches and all these brain symptoms that folks are getting with that. So I wanted to let you know really the connection of how the virus gets to your brain. And now you've seen the connection, right? You've seen the picture, the olfactory nerve of how this virus gets up there. And so much more important is the need to wear that mask, because that's how it gets up there, right? That's how it gets up there from folks who caught it one way or another. If it gets through your nostril, guys, that's how it gets to your olfactory nerve with that. All right, did you guys learn something today? You know the connection now, right? Between the brain and COVID, because we always think about the lungs and COVID, but there's a huge connection with the brain and COVID. And now you can tell different folks, about the olfactory nerve and why people lose their sense of smell. Now you know, because the virus, as it goes up there, it damages the nerve on its way to the brain. With that, right? Man, we spent like an hour and a half, guys. I'm glad you're still on. All right. Hey, well, God bless. I'll let you guys go. So Monday, December 14, 6 p.m., let's come back, let's meet, and let's talk about cancer. And I'm going to tell you everything you need to know. It's really neat stuff about how cancer is more than just a mutation of your genetics. It's more than just that. And we'll have some strategies for you at that time on how you can affect the direction of cancer as well with your lifestyle. And of course, we'll do the test the assessment test from Stanford to show you how to assess your past behaviors and past experiences and things of that sort. Yes, Winnie?
Yeah, I was just curious. On the news, they were talking about all the distribution of the vaccines, and I was just wondering what your thoughts were on all that.
Vaccine, yes. So real quick, I only trust 2 vaccines right now out of the several that are there. and it's because of the data and the way I've looked at the data. So the ones that I am comfortable with personally is I'm comfortable with Pfizer. I'm comfortable with Moderna. Currently, they are the mRNA vaccines. Those are the vaccines that uses genetic material to, and we chatted about that last time, right? We were here on that. mRNA, hold on here, RNA vaccines.
Doctor, is that the same as monoclonal antibody?
It's different. It's not monoclonal antibody.
Okay, thank you.
Yes, the one that I'm iffy right now, that I don't fully trust is I don't fully trust AstraZeneca, because the complete data is not out yet, and so I have some questions about it. It's not that it's bad. I just don't see the entire data set right now. Johnson & Johnson is working on a phase 3. Johnson & Johnson is a one-shot deal vaccination. The other 3 are 2-shot vaccinations separated by 3 weeks apart with that. So Johnson & Johnson is a little behind the other 3, but they're coming as well. There's probably over 10 in phase 3 right now that are.
The good thing with Johnson & Johnson, I actually work there, is it doesn't have to be stored in freezing temperatures. So the supply chain and distribution reaches a larger amount of people, which is good, opposed to the other ones that have to be stored in like freezing temperatures.
That's right.
So that's definitely a benefit.
Yes, that's a plus. Yeah, the storage and distribution would probably be easier with Johnson & Johnson because it doesn't have to be negative 90 degree with Pfizer, right? Yes. So the FDA is going to make a decision on December 10th. The FDA is going to make a decision on approval, which is perfect, guys, because when we meet on December 14th, we can talk more about it, right? On what the FDA approved and what the actual data looks like, and which one. So I'll look at that on the 10th, and we'll chat on the 14th about that as well. That's perfect timing for our next chat, the 14th, a few days after the FDA. Dorothy says, do they test you after to see if you're positive response? No, it's like the flu shot. They don't test you. They're testing the people now in clinical research to see if they're positive. But once they go live and it's FDA approved, they won't test you. All righty. We will see you guys on the 14th. We'll chat about the FDA approvals. We'll chat about we'll chat about cancer, and we'll chat about the assessment tool from Stanford University, and we'll do a live question and answer on the assessment tool so that you can see how this goes with that. All right, guys.
Thank you. Thanks, Dr. Tran.
God
Thank you
bless.
very much. Thank you. God
Yes.
bless you.
Take care.
Thank you, Dr. Trin.